This is a tutorial on how to utilize the Shoulder Symptom Irritability Scale for patients with shoulder pain. So what guides intervention intensity? When a provider examines a patient with shoulder pain, they not only need to determine what is wrong with the patient, which is the diagnosis, but also the appropriate dosage and intensity of the interventions necessary to resolve the problems. In other words, the general loading strategy needs to be guided by something. But what? Symptom irritability, sometimes labeled as acuity, severity, or tissue irritability, among other names, has been described in one form or another by many clinicians and researchers over the past 50 years, such as Jeffrey Maitland, Anthony DeLito, Michael Mueller and Katrina Malouf, Lori Brody, Edward Barakat, Philip McClure, and Marty Kelly. In each of these cases, symptom irritability was described as the guiding principle for intervention intensity, and sometimes even intervention type. Symptom irritability has been described for the shoulder by Kelly and colleagues in 2009 in regard to intervention planning for patients with adhesive capsulitis. Shoulder symptom irritability, again, was agreed upon by the Orthopedic Sections Task Force for Shoulder Pain Guideline Development in 2013 as a major component for intervention planning for patients with shoulder pain. Most recently, McClure and Michener proposed a staged approach for rehabilitation classification for shoulder disorders, or STAR Shoulder, in Physical Therapy Journal in May 2015. Conceptually, shoulder symptom irritability is meant to be a judgment about how inflamed tissues are at the time, and how ready those tissues are for physical stress in the form of exercise and functional activity. Historically, tissue irritability has not been operationally defined and is left to the intuitive judgments of the clinician. And while shoulder symptom irritability has been repetitively proposed for use, it has not been studied for reliability or validity. Therefore, we are studying shoulder symptom irritability to see if it is a good model for which to guide intervention intensity. The Shoulder Symptom Irritability Scale is broken up into 3 categories: high, moderate, and low. Each category is based upon criteria including pain level, presence of night or resting pain, onset of pain during motion, comparison of active and passive mobility, and disability level. Each category is considered to be mutually exclusive, which means while a patient may have some qualities of different categories, there will be one particular category that stands out the most for each patient. The high shoulder symptom irritability category consists of patients with higher levels of pain with regular activity, typically at or greater than 7 out of 10 pain, consistent night or resting pain, active range of motion that is considerably less than passive range of motion, higher levels of disability on a patient-reported outcome measure such as the Penn Shoulder Score, and pain that occurs prior to tissue resistance when passively moving through the available range of motion. So an example of high shoulder symptom irritability is a 56-year-old female with insidious onset of left shoulder pain and progressively decreasing ability to raise her arm over the past 4 months. She notes shoulder elevation causes 9 out of 10 pain, but always has pain even at rest. Active shoulder elevation is 80 degrees, and passive shoulder elevation is 100 degrees, with pain during the last 40 degrees. Penn Shoulder Score is 34%. And for those of you who are not familiar with the Penn Shoulder Score, 100% equals no disability. The aspects of this case that denote the high shoulder symptom irritability are the 9 out of 10 pain, the consistent resting pain, the active range of motion being considerably less than passive range of motion, pain prior to end range during that passive range of motion, and high functional disability levels at 34% on the Penn Shoulder Score. The moderate shoulder symptom irritability category consists of patients with moderate levels of pain with regular activity, typically between 4 and 6 out of 10 pain, intermittent night or resting pain, active range of motion that is nearly the same as passive range of motion, moderate levels of disability on a patient-reported outcome measure, such as the Penn Shoulder Score, and pain that occurs along with tissue resistance when passively moving through available range of motion. So an example of moderate shoulder symptom irritability is a 56-year-old male with insidious onset of right shoulder pain over the past 3 weeks. His pain is intermittent and is especially worse after painting the walls of his new house. After doing a lot of overhead activity, his pain is 5 out of 10. He reports he has pain with reaching and at times awakens with pain when he rolls onto his right side in his sleep. Active shoulder elevation is 155 degrees and passive elevation is 160 degrees and is only painful at the end of range of motion. Penn Shoulder Score is 58%. The aspects of this case that denote the moderate shoulder symptom irritability are the relatively moderate pain levels at 5 out of 10, intermittent nighttime pain, active range of motion and passive range of motion being within 5 degrees of each other, pain only during end range of motion passively, and moderate levels of disability with 58% disability on the Penn Shoulder Score. The low shoulder symptom irritability category consists of patients with low levels of pain with regular activity, typically at or less than 3 out of 10, no night or resting pain, active range of motion that is equal to passive range of motion, low levels of disability on a patient-reported outcome measure, such as the Penn Shoulder Score, and either no pain or only minimal pain that occurs along with overpressure at the end of available range of motion. So an example of low shoulder symptom irritability is a 56-year-old female with right shoulder pain that began 1 month ago after a very intense shoulder workout. She doesn't recall a traumatic event, but the pain began later that day and has not gone away despite resting and trying to ice her shoulder. Pain is not getting worse, but is not improving either. She has no pain at rest, and while her pain is only 3 out of 10 with heavy lifting, she needs to be able to push heavy hoses overhead as she is a firefighter. Active and passive shoulder elevation are 170 degrees and is only painful with lifting heavy weights overhead or with overpressure. Penn Shoulder Score is 74%. The aspects of this case that denote the low shoulder symptom irritability are no pain at rest, pain only at 3 out of 10 with activity, active range of motion and passive range of motion being similar, pain only with overpressure at the end of passive range of motion, and a low level of functional disability with 74% on the Penn Shoulder Score. In summary, the shoulder symptom irritability scale is broken up into 3 categories: high, moderate, and low. Each of these categories is based upon criteria including pain level, presence of night or resting pain, onset of pain during motion, comparison of active and passive mobility, and disability level. Each category is considered to be mutually exclusive, which means while a patient may have some qualities of different categories, there will be one particular category that stands out most for each patient. Now we have some cases to give you practice rating these patients. Remember, a patient does not require all criteria to be classified as a particular category, but rather a predominance of a particular category is required. The first case is a 37-year-old female with right shoulder pain that began 2 months ago after trying to stop a patient from falling. She has tried self-management with NSAIDs and ice, but is no longer able to perform her work duties safely. She reports 8 out of 10 pain with donning a bra, and she is waking due to pain 3 to 4 nights a week. Active shoulder pain Active shoulder elevation is 155 degrees, and passive shoulder elevation is 175 degrees, and is painful throughout the latter half of motion testing. Penn shoulder score is 64%. So now take a moment. What would you rate this patient as? The shoulder symptom irritability for this patient is high. While this patient had only intermittent nighttime pain and moderate disability, which are components of the moderate shoulder symptom irritability level, she had high levels of pain with regular activity, 8 out of 10, a drastic difference between active and passive mobility, and pain throughout the range of motion, resulting in a high symptom irritability classification. The second case is a 37-year-old male with left shoulder pain that began 1 month ago after lifting his son overhead while in a supine position. He tried self-management with rest, NSAIDs, and ice, but the pain is not resolving. He has 4 out of 10 pain with his daily activities. He denies nighttime pain. Active and passive shoulder elevation is 160 degrees and is painful only at end range. Penn shoulder score is 44%. Again, take some time. What would you rate this patient as? The shoulder symptom irritability for this patient is moderate. While this patient had no nighttime pain and equal active and passive mobility, which are components of the low shoulder symptom irritability level, he had moderate levels of pain during daily activities, 4 out of 10, had pain and range of motion, and had a moderate level of disability, resulting in moderate symptom irritability classification. Please feel free to go back through this and get more practice at doing this rating system and using it on your different patients prior to utilizing it during the study.